Earlier today, I gave you this patient and asked you why you see bubbles, in particular in drowning patients. Let's talk about that. Okay, so let's talk about the lungs themselves and why we see these bubbles that come out in a patient that has drowned. Well, here's the thing, is that in the alveoli, you don't just have tissue, you also have a fluid that lines the alveoli called surfactant. And it's something that we produce naturally in order to effectively keep the alveoli open and basically create surface tension, which is a fancy way of saying it allows and helps keep the alveoli open like so, and they don't collapse on each other. So when we introduce fluid in a drowning situation like so, it mixes this surfactant with that fluid. And what it does is it creates this more sticky kind of mess, particularly inside the alveoli itself. So when we introduce ventilation down in here, it mixes with this fluid that's now kind of a sticky mess, creating all these bubbles that's now bubbling out of the airway. So that's effectively why we see bubbles in a drowning patient when we ventilate them, is because all of this mixing of water with the surfactant that's now bubbling out of the airways, and which is what we're seeing.